Well, good afternoon to everyone. Thank you for joining today's webinar. You know that it is almost a tradition that we start the year with this kind of webinar. So, as you already may know, we have already started the monitoring exercise, and the idea, as you know, is that with this webinar, we can solve any questions or doubts that you may have in order to fulfill that requisite. So as you know, we will record also the session, so we will make it available in TransplantChild website, so others may consult and take a look at it afterwards. So you probably know myself. My name is José Jonay Ojeda. I work at La Paz Hospital. I'm actually the co-coordinator of the network, helping Dr. Hernandez in the coordination team. And as you also may know, I am in charge of the work package number 3, that is about evaluation. You know that in this last grant, we are placing in this work package all the activities that are in relation to the improvement, the quality, the standards, the measurement of the activity we do in our network. And as you also may know from previous sessions, I work as a preventive medicine and public health consultant here in Madrid. I also work in the Madrid Autonomous University nearby as associate professor, and I also have some involvement with some public health administrations at regional and national level. My field of expertise is quality improvement, so that's probably my conflict of interest, no, in doing this session. That I really think that these kind of tools and this kind of exercise help us to improve our activity, and of course, in a network as ours, you know that one of the requisites is that we monitor and we provide feedback of the activity we do in order to tell other stakeholders what we are doing and then to improve our activity as a network. So just in order to give some background, you know that our network is about pediatric transplantation. We have 40 centers with 135 active transplantation programs participating in the network. Last year, when we did this exercise, you reported us 1,991 new patients in the previous year. And as you already know, we have doing this monitoring for several years, and we keep record of what we do in the network and validate data every year. So this year, as previous years, we have this this background from all the networks that was set up 8 years ago. You know, the networks started 9 years ago, but a year later, there was a consensus to use a common set of core indicators. 1 year later, we started with the surveys. First, we undertook these surveys specifically from TransplantChild, and 3 years ago, also the DGSante promoted that the centers also participated in the monitoring IT tool that it is open in order to report directly to them also the activity. And well, as you probably know, this is integrated in a wider strategy of assessment, monitoring, evaluation, and quality improvement. And probably also you know that for the first time in the history of the networks, the DGSante published the first monitoring report containing 2023 and 2024 data last November. You know that in the last grant, there was a modification of some of the indicators we are collecting. And since then, there's no further changes, and as we will see through this presentation, we have had already one presentation from the Sante a couple of weeks before, and we know that no changes are expected for the monitoring exercise that is already under place from the Sante, and we also want to make no additional changes in the survey we will launch this year in TransplantChild. This is the strategy, just to remember you that this system does not only rely on the information that all of you, the healthcare providers who participate in the networks and the coordination teams, but also what the member states collect about what the different members are doing in the different networks. And also, you know that we have to keep in mind that patient representatives also can and will in the future provide indicators in order to be into this strategy of quality improvement. As I have already mentioned, and we did some information, we gave some news when it was published last November after several tries that didn't get to the end. Finally, when we finished last year monitoring exercise and the Sante collected data from 2024, finally they presented the coordinators of the 24 networks this information before summer, and after a debate which tried to make possible that the published data had the best quality possible. Finally, this first report was published last November, and this, as it was the first one, probably the idea is that it won't be published at this time of year, but they are telling us from the Sante that with this year monitoring exercise, probably they want to have this report published before summer. So probably this year we will have this report on May or June. It depends on whether we achieve and do it correctly the two phases in which this monitoring exercise is structured. And I will talk about that accordingly. As you know probably from previous years, in the last three occasions, the Sante has established these monitoring exercises in two stages. The first one started at the beginning of January, and it will end in the 28th of February. And what is expected is that each center, as we will see later, and we will remind because it hasn't changed from the previous years, the idea is that each center decide whether they have a different reporter from each ERN they are participating in, or they can aggregate this report through a single reporter. But the idea is that each center provide two indicators directly to the Sante in these first 2 months of the year. And followingly, on March, then we will have the chance from the coordination center to fill up the rest of the indicators and also to modify, if it's needed, the information that you may have reported earlier. We will see that in the next slide. This first stage, as I mentioned, it will finish like last year at the end of February. This is not the first time we do it in the networks. There is already a person identified by ERN, by each ERN and each center that have the access to this IT tool that has been it's been provided by DigiSante. And the idea is that if you know that there has been a change in that person that was providing this information in previous years, please let us know that there has been this change in order to keep track and to be sure that there's a person in your center that can provide this data, and there's not been a problem because this change of appointment. Um, of course, this IT tool is like other platforms associated with an EU login account. That is not new. It's the same as CPMS. Of course, it's sometimes we have issues with that EU login, but the idea is that you can directly put this information into the platform, and in these 2 months, there's only going to be access in the form for the HCPs. The coordinating center will not have the opportunity to access the different information that you are providing until we reach stage 2. You probably, if it's not the first time that you attend this webinar and you have done this monitoring exercise from previous year, you already know how the IT tool looks like. It is not a very big formula form, because you know that they are asking only for two indicators, or you already know that they ask for new patients. If you are using in some way, I mean, it's only yes or no, the ORFA codes in your centers. And of course, as I mentioned, the idea is that you, during these 2 months, you provide this information inside the platform, and accordingly you will have probably because we are starting the year, to have some additional time in order to collect that information from all the activities that you do that are into the different ERNs. You probably know that we have done some clarifications according to what we consider new patients in TransplantChild. We have to keep in mind that you may participate in TransplantChild with 1, 2, or even more transplantation programs, or even you can have a transplantation program which only do follow-up. But the idea is that we consider a new patient when that patient has come to your center and to any TransplantChild hospital for the first time. The idea is, as you probably know from previous exercises, is that the ESNT wants to maintain, to have a number of how many European patients are being attended for the first time in all the networks. So that's the idea. For example, if that patient is included in waiting list, then it has already an indication for transplantation, and in that case, if it's the first transplant, is the first time that you attend it, then it will be a new patient, or even if it has been transplanted in another center outside TransplantChild and you do the follow-up, that also will be considered a new patient for TransplantChild. This is an indicator that we have been working for some time now, but if you want to have further clarification, please just wait. I mean, you can raise your hand now, or better, we can talk about that at the end of the talk, so we can gather all the questions and try to answer them properly. So this, as I mentioned, is one of the 2 indicators that HCP has to provide until the end of February. And the other one, as I already mentioned, was the ORFA code. And then in March, we will, as you know already from previous years, collect all the information we have in the project, in the grant that you know we are, that is sustaining the network since 2023, in order to collect this data and put it into TransplantChild. But as you already know from previous years, at the same time, we will launch a survey in case you have some information regarding these indicators that you may have directly and that we may not have it in the coordinating center. You know that these indicators, as I mentioned at the beginning, is in relation to the core activities of all the networks. For example, the CPMS activities, the activities we do in training and education. For example, this webinar, that we count it as a webinar, as an activity that it is later on reported to the monitoring exercises. Also, that we collect information of the different clinical trials and observational prospective studies that we do in TransplantChild. That we have to take into account certain criteria in order to consider one of these activities a TransplantChild activity. So we will talk about that later. Also, we collect publications, the patients we upload to Peter, our registry, also the clinical practice guidelines and the other decision-making tools that we are promoting within TransplantChild through the project also, and the congresses and conferences that we participate, the visits that our website has, and the downloads that we also can count from the website. That also for a long time we have identified other indicators that they are of interest in our network. But as you know, in the last surveys that we have prepared, we try to ask you only for some of this information, the ones that we are not able to get from other sites. We will see about which kind of information we ask in the survey, and the idea is that you identify this information and you provide this information through the survey to the coordinating center, so we may later on add all the information together and put it into the IT platform of the DG Santé in March. This is the survey. Again, we have tried, what we have done is to just review last year and try to see if it was possible to do it in the same way. The idea is that, as I mentioned, taking into account the presentation that the DG Santé has already done last January the 8th, the idea is that tomorrow we will start formally the survey, the TransplantChild annual survey, collecting the activity from 2025. That you have to identify in this EU survey in order to know that the center that is giving us the data. The idea is that, again, you do a work ahead in your hospital, in your center, in order to gather up all the information, and later on only one person answered the survey, and we get all the information as a center from all the different transplantation programs. I can add on this that, for example, in La Paz Hospital, we have decided this year to present this information in a clinical committee we have done, joining all the transplantation programs in children that we started last year in February. And the idea is that next February we will do a meeting where we will gather all this information together. And so, as I mentioned, it is not the task of one person to collect all the information, but all the services who are in charge of the different transplantation programs, they join together and they put this information together. That is, for example, one thing that we will do this way this year. But of course, there are other ways. The idea is that we got the information and that you provide it through the survey until, as you can see, mid-March. We will talk about that. We will start tomorrow. The survey will be open tomorrow, but the idea is that we collect. It will be kept open until the 15th of March. So we have after that 2 more weeks in order to collect all the information and to provide it to the DG Santé. What information are we asking all the 40 centers that participate in TransplantChild? Well, we ask for the transplantation activity. I mean, not only the surgeries or transplantations performed, but as I mentioned, the new patients, The idea is that you provide to DigiSante the total number of all the transplantation programs, and later on in the survey that we will launch tomorrow, you provide that information per transplantation program. I mean, as you know, the different solid organ transplantation and also the hematopoietic stem cell transplantation program. We also want to collect the information that you may have available about survival in your transplantations programs. In case of solid organ transplantation, the patient and graft survival, and in case of hematopoietic stem cells, the patient overall survival and day 100 overall mortality. We changed that last year, and the idea is that we get the usual information that you produce in order to know what is the survival results, what are the results of the different transplantation programs. Of course, we will, as I mentioned before, ask you if you have any specific activity with acknowledgement of TransplantChild that you want us to know, so we report them in March as a summary of all the activities done in the network. For example, the use of ORFA codes, we will check that with information that you will give DigiSante, the education and training activities, the trainees, the clinical trials or observational studies that you may have launched, the publications, the guidelines, other clinical decision tools, as I mentioned before, congresses and meetings, etc. And again, some other information that we find it useful to know how the different hospitals participating in the network may have done last year. For example, if they participate in research consortiums, if they have certifications, quality certifications or accreditations in about transplantation programs, or if they have done specific materials aimed at patients. Again, as you can see in the slide, we will not ask for a full list of additional activities, but please, I mean, if you have doubt, just put it into the survey. But when we will review it, we will keep only those with acknowledgement of TransplantChild. You know that it, of course, that acknowledgement is usually obtained through the activities of the different work packages and the meetings we have, the board of the network, or other meetings that we have among the members. But also in some cases, there is a specific number of different countries and different centers that have to participate in order to be considered an activity that counts for networks, for European reference networks. As I mentioned before, the deadline for the 40 centers will start tomorrow and will finish on Sunday, March the 15th. For the indicators, please try to provide, as I mentioned before, no publications, guidelines, etc. Try to provide those where there's evidence that can support these activities. And as I mentioned, we didn't change the format. You know that we have a clarification document that we will send also tomorrow, and you can also ask for us for that document where we try to explain with examples how to produce the activity indicators, okay? And of course, we have the information that you have sent us in previous occasions, and we will do a comparison with that information that we have from you from previous years and the one that you are sending us now in order to do validation. So we will try, as I mentioned, to make sure that data are valid and that have the appropriate support. If you miss out the stage one, of course, we won't be able to change that in the IT platform that of DigiSante, but we will put that information directly from the coordination center into the platform in March. Again, of course, we cannot change the IT platform, but if you don't fill up the form of your center by the end of February, that will be recorded blank. But as they told us, no, they take into consideration that participation and provide that information to the different member states in order when the evaluation of the centers that that we will have next year another 5-year evaluation process for all the networks. So that is also information that can be taken into account for future evaluations. As I mentioned, we will do internal validation with the data that you give us and the data we have from previous years, but in the board of the network that we will do in Madrid in May, and in meetings of the work package 3, we will do additional validation activities for the data that we would have collected by then. Again, that has happened to us in other occasions. In some cases, some centers were not able to provide the data, not in February, but also not in March. In those cases, we encourage you to provide us the data, although we will not be able to give it to DigiSanté. As I mentioned before, this monitoring exercise is very useful to our network in order to know what the activity we are doing all together. So please, if you are not able to meet the dates, contact us, and we'll be very glad at trying to help you in order to reach those dates, or if those dates are over, at least get your data so we can have a full overview of the activities that we do together in the network. In summary, we have no changes in this 8th annual survey. As I mentioned, we have these core indicators that we have been collecting from almost the beginning, but we also collect information that has an impact on the grants that all the ERNs are receiving for maintaining the networks. Again, we need that all the centers try to reach the expected dates. As I mentioned, forms will not be able to be changed later than February 28th, not even by the coordination center. And apart from that information that you will be provided directly to the DigiSanté and that we will have access in March, we will again launch this survey from TransplantChild in order to complement and to fill up the gaps that we may have from the activity done in 2025, and we will put it in the IT tool before March the 31st. And as I mentioned earlier, the intention of DigiSanté is to publish the report in May. So probably this year we will not have extensions. We will not have additional time. So we have to be very careful with the dates and try to reach them. Just to remember, as you can see in the slide, that if we participate as centers in a network, that means that it's compulsory for every HSCT to participate in these monitoring exercises. And please remember that we have the operational areas, that one of the tasks they have is to follow up the participation of the 40 centers in the monitoring, and that they will be also there to support this process together with the coordinating center. And that's all. Well, you already know the areas. I don't have to be more explicit about that. You know that we are acting here as a team. And just to finish, please remember that the DigiSanté IT platform is already open for each center, for the 40 centers of TransplantChild. please check out if the people who reported last year is already active. If not, please tell us in order to change that into the monitoring platform so that the new person can access and introduce this information in time. Of course, you're already doing it because all the transplantations programs do it. But remember that you have to collect and prepare the information that we are requesting through this monitoring exercise, and that this additional information we will ask for it also in the survey that we will start tomorrow and that we will finish in the March the 15th. Again, this activity is the core of the quality improvement strategy of the 24 networks. And of course, if we participate and we keep this monitoring system in place, we will be able to tell others what we are doing. For example, the report that I showed you before, but also we will be able to identify changes or things that we have to change in the network in order to improve our activities in the future. That's all. Please, now we have a time in order to let know if you have any questions or comments. Please, we have now some minutes for it. Thank you very much for your attention. Federica, please go ahead.
Ciao. So the questions are the same. So
Yep.
it's just, a new interpretation, because every year, and when you deal with those questions, then you might have new questions.
Yep.
So I was wondering, it's a remote, very remote possibility. But let's say that a patient is transplanted in 2025, let's say in Bergamo, for any reason. But then at the same year, it is transferred to Padova for follow-up.
Yep.
As I said, it's a very remote.
Yep. It's an example.
In this case, the same patient would be counted twice as new patient, as, transplanted in Bergamo and follow-up in Padova.
That's right.
Is that okay in terms of the number?
That issue was some of you could connect on the webinar they did 2 weeks ago. I mean, for DigiSante, for them it would be two new patients. If you ask me, and I work on quality improvement, I would say it's one patient. I mean, if we are aware of that has happened, I say that if we want to be valid and to give a good quality data, it would be one. But of course, we're talking about that sometimes we don't have the proper tools in order to know that. I mean, the people who gets the data and are reporting may not have that information. So I would say, of course, if it's a new patient when you have it in your center for the first time, you know that these pediatric patients can, of course, if everything goes well, will stay with us for a long time until transition. But those are not new patients for DigiSante. Although we keep doing follow-ups, we keep doing things. For DigiSante, it's when they get in contact with an HCP for the first time. And I would say, a recommendation from us is that if you are aware that that patient has been attended before for that indication of transplant, I mean, you know that maybe they are different indications from transplants. In that case, we could argue more about if those are new patients or not. Again, if it's the same indications, for me, it would be only one patient. But again, in this case, we have the information that we have the dates that we have, and the good is not enemy of the. I mean, you know what I mean. It's just try to do it as best as possible. And even if you have doubts about any of these, you know that in the DG Sante platform and also in our survey there are comments, question and open answer questions, and you can write that there. And when we gather all the information, we can even discuss that, as I was mentioning, in the meetings we have in the work package 3 or even in the board of the network if we think that's relevant to all the members. So it's not close. I mean, we can see about what is going this year, and of course we will try to make it better.
Fantastic, thank you. I totally got your point. Then another practical question. So you said you will send the link to the TransplantChild internal survey tomorrow, or I mean in those days, right?
Yep, that's the idea, tomorrow.
Okay. Thank you. And the last question, again, we have discussed it last year, but again, with the usage, it could be different interpretation. The question about the ORFA codes. Does your center use the ORFA codes? Of course, in this case, we are talking about our ORFA codes, the one related to TransplantChild.
Yep.
What is intended by usage? I mean, that a system is in place in the electronic health records, then the clinicians are familiar with those ORFA codes and they are using them, let's say, I don't know, in their practice, but it's not recorded in the health records. Because, does your center use, we can always argue, is the usage connected with the electronic health record system or with the practical knowledge and usage of the ORFA codes?
I would say the second, but again, we had that webinar 2 weeks ago, and they didn't change this definition.
Exactly.
So they allow us to interpret it the best way we can. So I would say let's try to be coherent with what we said the previous years. And if we said the previous years we are doing it, I mean, it would be straight to say this year we are not doing it. Although there has been some change of whatever, big change, but there's no additional clarification for that.
Yeah, I was asking this question because the webinar, as you said, was very vague. So I was asking you if we, as TransplantChild, has a narrow definition.
You have already mentioned it. I would try to apply it in transplant. I mean, in the transplant programs. I mean, if we have experience already in any transplantation programs in the use of ORFA codes, I would say that we could click a yes. But as you mentioned, there's a wide range of yes.
Okay, thank you very much.
You're welcome, Federica. I guess there has been some comments in the chat. Let me check it out. Perfect. Some people. Can I read back the presentation? Yes. Again, the idea is that, I mean, Jorge, you can correct me, but the idea is that, as in previous occasions, we will put all the documents we are giving you tomorrow, and also the link to this webinar in the website. That's right, Jorge?
Yes, in the website and in the survey too. We were the link of this webinar video uploaded to the YouTube channel. Okay, so.
Because some people was asking is if they can read back the presentation somewhere. The idea is that this webinar, as the other ones, again, this is a quality focus. No, we try to that it can also count as an educational activity. So that is, it has to be on the website. It has to be available. You can reach it at as many times as you want, and of course you can contact us. I mean. You know that in that case, Jorge is our monitoring man. Together, he and me try to answer all your questions. And as Federica has mentioned, when you are with the data and you are with the formula, I mean, with the form, you usually get some more questions that you may not have today. So please don't doubt to contact us, to contact the coordination team, and we will try to clarify that doubts that you may have further on. Anything else you want to add now? Well, I think we don't have to be until 3. So I would like to thank all of you for attending the meeting. As I was mentioning, please, when you get that email for the monitoring, or when you start to focus on that, if you have any doubt, contact coordination team, contact us. Also, take into account that operational areas are there in order to support and to help the monitor that you can monitor and do these activities also. And we'll keep in contact as usual. Okay? Thank you very much. See you soon.
Thank
Bye
you.
bye.
Bye bye.
Hey, there's a hand. Wait a minute. No. No, there's a hand. Bye bye.
Okay, bye.